So thank you everybody for attending this second part of the medicinal cannabis webinar that we're doing through Pain BC. Those of you that attended the first part should have had a good introduction to the pharmacology and the kinetics of the medicinal cannabinoids. And the second part, I'm going to be talking about the practical aspects of medicinal cannabis, such as how to access it and how to actually use it. As I've mentioned in the first part, this is primarily aimed at healthcare providers, but I know that it will be available to patients as well. So I'm hoping that it'll be useful from both aspects. This is actually one of the situations where the patient's knowledge and the healthcare provider's knowledge actually are fairly equal often. In fact, many of my patients have been vastly more knowledgeable about medicinal cannabis than I have been. So I think there's not really any value in artificially separating the two. We know that there are the two prescribable forms of medicinal cannabinoids. The Sativex spray we talked about before is the 50-50 mix between THC and CBD, and it's used as a buccal spray. We also have the Nabalone tablets, which is pure synthetic THC. The trade name for that is Specimet. And these are both drugs which are available by ordinary prescription from any physician who is willing to prescribe them. And they can be paid for by Extended Health, though are not covered by regular BC medical pharmacare. The new process for access to the legal dried product, which is the flowers, is in the process of implementation, and this is the beginning of June, end of May. We need to review this in the next few months, because I anticipate that if I was giving this talk in 6 months or a year's time, I may have a whole lot of different information about what the actual process is. So the process for implementation really has not gone according to Health Canada's plan. In fact, there has been a legal challenge to the plan, and it may never be fully implemented. So in the meantime, the Health Canada approval process, which used to be in place with the forms which had to be sent in to the federal control agency, they have been suspended, so nobody is doing them anymore. There used to be a sort of green card that people got through Health Canada, and those are no longer being issued, but each individual licensed producer or dispensary has been giving some kind of identification to patients, and this probably will continue. So because it's a bit of a mishmash of procedural uncertainty, I'm going to try and cover the legal and the illegal parts so that everybody's kind of comfortable with what their options might be at this time. So if you're looking at the currently illegal process, the traditional one has been that patients grow their own. And many patients that use it recreationally do this. In fact, many patients that do it medicinally do this, especially for the non-cancer indications. But for many patients, especially cancer patients, that find out that they have a need for this when they're relatively sick, they don't have the skills or the strength or the resources to be able to actually grow their own. Sometimes they're able to have a friend or an unlicensed grower that's able to provide some marijuana for them, but the quality is not assured. There's a whole lot of criminal activity used in association with this, with the medicinal users being sort of used to provide the front for the criminal activity, and the type of cannabinoid that's being delivered to the patient may not be optimal for their actual use. As we mentioned in the first webinar, the proportion of the THC to CBD, cannabidiol, is quite important for the effectiveness and for the tolerability. And many patients who are using medicinal cannabis to become normal, to get rid of an unpleasant symptom, they don't want to get high. They don't want a high THC variety, even though you need a little bit of THC for the therapeutic effect. You want it to be balanced by a significant amount of CBD. And the recreational strains of marijuana, which have been developed by people who are using it for the purposes of getting high, are often not the kind that would be suitable for medicinal use, certainly not for a cancer patient. So you do need to have some kind of control over the supply, and that's where in the past the dispensaries have come into play. The most common dispensary that I find works well for us is the Compassion Club in Vancouver on Commercial Drive. There are many other dispensaries, and I don't have any favor over any particular one. There are some that are better than others, and some that are more user-friendly than others. But if we can just kind of group them together for now, the general sort of approach is that people may attend in person. That's great if you live near one, but if you're in an area where there isn't a dispensary, then you may have to travel a considerable distance, or you may have to do it by mail order, which is somewhat challenging. The quality does vary a little bit, but in general it's much better than if you were just getting it from somebody who's growing their own, unless they're very well informed. One of the advantages of going to a dispensary is that there are often multiple products that are available, and the staff are often extremely well informed. There are butters and a variety of different honeys and a whole lot of different kinds of things which people can get. They can also get advice on equipment for using it by vaporization, such as the various different kinds of vaporizers. Volcano is one which is commonly used. You can buy these things on the internet as well. But being able to actually go to a place where you can look at them and compare, especially when you're speaking with a knowledgeable person, it really is quite useful. And that's something that may be lost when we move more towards the licensed producers that are on the other end of the internet or a telephone, but not in person. So the legal position regarding the dispensaries, as is in the slide here, the Canadian federal law prohibits the possession and the use of cannabis, which is actually punishable by imprisonment. There are quite substantial penalties for this. They are, however, not applied, and the federal law is universally basically ignored by provincial police forces, because the Canadian Charter of Rights and Freedoms guarantees that everybody has liberty and security of the person, and the courts recognize that being able to use cannabis for medicinal purposes is actually part of that right to liberty and security. So the government, in order to reconcile those two, they have this process to exempt them from prohibition, which has been it's sort of added to by the informal process of the police deciding or choosing not to prosecute. So there has been an access program, the MMAR, Medical Marijuana Access Regulations, and now we've got the MMPR, which is more the prescribing, medicinal marijuana prescribing. And I'm going to tell you a little bit about the legal route, the marijuana for medical purposes regulations. And this is different to the previous regulation because the responsibility for deciding how much cannabis is going to be provided to a patient is now required to be specified by the physician. The physicians have an option to decline to accept the role. It's not something that all physicians have to do, but the responsibility for deciding which patients are medically qualified is firmly in the hands of physicians to a greater extent than it was before. So the templates for the prescriptions or the authorizations, the medical documents, whatever you want to call it, are available on the Health Canada website. And there are a number of licensed producers now, lots and lots of applications, hundreds of applications in, but a relatively small number already approved. And the individual licensed producers also have developed their own forms, which essentially conform to the template from Health Canada, with a little bit of personalization, putting the particular logo and maybe changing the font, etc. So the licensed producers are only allowed to sell the dried cannabis, the mixture of leaves and flowers, and they're only allowed to sell by mail order. The licensed producer is also required to confirm with the doctor's office. The doctor, it could also be the nurse practitioner, but the person who's done the authorization they have to confirm after receiving their authorization that that was indeed from them. So there's a little bit of an extra step regarding paperwork there. This is a list of the licensed producers. If you see the ones that are in purple, those are the ones that are in BC, and you can see that across the country, BC is actually very well represented in licensed producers. There are quite a lot of companies in BC that were very quick off the mark in getting their applications in. However, having said that, if you go through the different websites, some of these licensed producers have no stock or only have very recently got stock in, and it may not be stock in all the different forms. One of the producers I was speaking to just this morning says that they have 40 different varieties, but the one that has the highest proportion of CBD is only 2 to 1, meaning that there's 2 parts THC to 1 part CBD. They don't really truly have a high CBD variety, but other licensed producers are ahead of the game and have the higher CBD varieties. So it does vary a lot from licensed producer to licensed producer as to what they have, and this will change quite rapidly over the next few months, hopefully with the higher CBD varieties becoming much more widely available. The process of authorization to use these licensed producers is that the patient is actually the one that has to take responsibility for selecting the licensed producer, but there are a variety of organizations out there which will help to direct the patient to the one that might work best for them. And this is certainly an area where I think there's going to be a lot of people trying to get in on the business of being a sort of an advisor to the patients as the middleman between the patients and the licensed producer. But the patient has to go to the website or to the telephone number for the licensed producer and then tell the patient that they have to get the physician declaration done by their physician. The patient takes it to the physician and the doctor completes it, and then the doctor or the nurse practitioner has to send it directly to the licensed producer. We can't just give the piece of paper back to the patient and say, okay, off you go, you can mail this. If the licensed producer is able to do this with their website capability, there may be capability for the doctor to actually directly enter it online and have some sort of pre-authorization so that the qualifications of the doctor have been previously established. So certain physicians may develop a relationship with a certain licensed producer to try and facilitate this process. Once the declaration is confirmed as genuine, then the licensed producer starts supplying the patient according to the dose that's been stated by the prescriber on the initial form. And this has all become very vague. There are a number of problems with the actual medical document, whether it's called a prescription or not, because we're not actually prescribing a specific dose. There are no determined therapeutic or safe doses for medicinal cannabis. There are guidelines based on experience from many patients in the past as to what average use is, but again, a huge variation in the doses, and as I mentioned in the previous talk, it can be anywhere from 1 gram a day up to 10, 20, 30 grams a day, depending partly on the patient's tolerance and how used to it they've got, but also on the method of extraction. If you have a very inefficient extraction method, you may need a lot of actual powdered leaves and flowers to be able to get a therapeutic dose of actual medicinal cannabinoid, whereas people that are smoking it or inhaling it, which is probably a more efficient way of extracting the active product, would be able to get away with less. On the other hand, we're not recommending that people inhale it if possible. So you may end up with people using quite large amounts of medicinal marijuana, much higher than the 1 to 3 grams, which would be considered the norm for inhalation. So that's the first part of vagueness, is trying to know what to actually write in that box which says how much. But then also it gets very vague as to what happens afterwards. With most prescriptions, like if I prescribed a blood pressure medication, then I would be following the patient. I would see them at regular intervals and monitor their blood pressure. I would adjust the dose according to outcome. whereas there aren't any requirements for medicinal cannabis, and there's no limit on the duration of that authorization. So essentially, once you've done it, that's a lifelong authorization, and unless there's a change in the authorization, the dose won't change. So if a patient wants to increase the dose, they have to get their physician to change their authorization. We don't know what would happen if a doctor or a nurse practitioner realized that the patient was misusing it or that it was no longer appropriate, but didn't want somebody to be diverting that patient's supply line. There doesn't appear to be a mechanism in place for the authorization to be withdrawn. So these are all these little things that are going to have to be all sorted out as time goes by. I've put here just a sample declaration from the College of Family Practitioners of Canada, which is very similar to the Health Canada declaration. These are some of the things that are suggested that are included in the declaration. That the patient does have a medical condition that warrants a trial of treatment with medicinal cannabis, or that the patient has reported that medicinal cannabis relieves the symptoms that are caused by a medical condition. So this isn't a requirement. I have referred many people to have a trial of medicinal cannabis who haven't tried it previously and don't have access to an illegal supply. So I'm sending them for the first time. So this second statement is somewhat negotiable. They suggest that the doctor states that the patient is not suffering from anything which might put them at high risk for harm related to cannabis. And as we mentioned previously, psychosis is probably the biggest risk here. Somebody that's got either active psychosis or a history of psychosis, or is at high risk of it because of a very strong family history. Also, that the patient has been informed of the potential risk for medical cannabis, and that the patient has been informed of alternative therapies. And though the college mention alternative therapies here in the context of alternatives to cannabis, many people would interpret the use of the word alternative as being things which are not traditionally medically practiced. And you could say that medicinal cannabis is actually an alternative therapy. They're not talking about things like high-dose vitamin C or acupuncture here. They're actually talking about traditional accepted medical treatments. So that's how the new process with the licensed producers is supposed to work. The old process, which is actually still ongoing, is with the dispensaries. And the whole idea with the new regulations, the MMPR, was that the dispensaries were supposed to close down. It was a worthy goal, but that hasn't happened. And the dispensaries are currently still allowed to operate. I don't know how long for, but if the licensed producers' products and prices become competitive and they do give good service, it may be that even if the dispensaries are not legally shut down, they may cease to exist because they're not financially viable, because people are getting a better product, a better quality product, and perfectly adequate customer service through the licensed producers. There's a lot of competition out there for the licensed producers. For example, this article was in the local Vancouver newspaper just recently. It was one of those free ones that they give out. That's a sort of abbreviated version of the full newspapers that they give out at the SkyTrain stations. And there was this little article about a new pot vending machine where patients can go into a local dispensary and they can just put money into the machine and get their marijuana out. There are obviously a variety of different choices there, just like you can choose which variety of crisps or which chocolate bar you want. But you can do the same thing with this machine. And the price is given here as I think it's, where is it there, $50 for half an ounce of high-end indica. Indica tends to be higher in CBD than THC, but there are variations in that. The prices that the licensed producers are talking about are more in terms of price per gram, and I understand that most of them are coming in around $8 to $10 per gram, but there are some producers that have procedures or special programs for people that are of low incomes, where it may come down to as little as $5 a gram. I don't know enough about the prices on the street to know how that compares with outside of a dispensary situation. So moving on, I'm just going to talk a little bit about the practical aspects of what you do when you get this little bag of powdered green stuff in the mail. It comes in a courier package, nicely labeled. So when you get this, you have to be able to tell your patients what to do with it. And of course, you can't just just eating it or just putting it in on salad or something like won't give you anything. You'll get very little THC because the cannabinoids are mostly very fat soluble. Having said that, some patients have found that if they treat the raw material by juicing it or eating it sprinkled on foods, they get less side effects than by inhaling it or taking it by other means. And it may be that it's just because they're not really getting much actual active product, or it may mean that they're getting more of the more water-soluble product in there rather than the fat-soluble, so they're getting perhaps more CBD than THC. And that's really unknown. On the whole, I would say it would be an extremely inefficient way of getting benefit, and you might need quite large amounts to get a therapeutic effect. So you have to release the active ingredients by some form, and obviously the THC is released by heat. So by cooking it, smoking it, or vaporizing it. You can also extract it by dissolving it in fat. So you need to have some kind of fat or oil to bind to it when cooking. If you're just making up as a tea with water, if you add milk or even soya milk, if you're not able to use regular milk, and simmer it, you can extract more of the cannabinoids out of the plant product than you would do if you were just boiling it in water alone. And there are some other recipes. There's one here for butter, which I just downloaded from the internet. There are many different recipes that are available. If you just do a Google search, you can come up with a whole host of choices. But this one is one that I know that I have patients that are using it and finding it quite helpful. They suggest that you take 30 grams, which would be, if you were doing 1 gram a day, would be a month's supply. So basically taking your whole pack of powdered cannabis and adding it to 2 pounds of butter and melting it in a saucepan. Initially, you want to make sure you get it melted, but then transfer it to a slow cooker set on very low. You don't want to run any risk of boiling it. You cook it for 4 to 5 hours, and I understand from my patients that it should be a sort of dark green color eventually. Then you strain it through a cheesecloth or some other similar filter to be able to get the little bits out of it, and then cool it. And then that can be used in any form. Either you can add it to food or spread it on toast, or mix it with a milky drink or a smoothie, that sort of thing. And that way you can adjust the amount that you're consuming very finely until you get to a dose which works quite well for you. Going back to the tea, there's a technique which has been in use for a long time, like thousands of years, and is referred to as bang in India. It's similar to Indian tea or masala chai. And essentially you have a mixture of the leaves, the dried product, milk, spices, sometimes some sugar, sometimes some clarified butter, and it's sort of boiled up. And there are many recipes on the internet, lots of local variations. And if you have less fat in the solution, you get a lower THC content. Also depends on the source of your actual leaves as to what the THC versus CBD content would be. Another cannabis product that I'd like everybody to just be aware of, even though it won't be available from the licensed producers, but is available from the dispensaries, I think it's an important product because I would really like to have access to this for future research. This is the cannabis tincture or sublingual drops. They can be in oil, usually olive oil, or it can be in alcohol. I understand from patients that have tried both that the absorption of the cannabinoids from the oil is a little slower, which may be a good thing, may be a bad thing, depending on what the patient's using it for. But the alcohol, though you do get a more rapid onset of effect, sometimes the alcohol can sting, and a lot of patients do have mouth sores, oral thrush, sore tongues, etc., which make use of alcohol by sublingual route or buccal route uncomfortable. So having a choice can be quite helpful. One of the advantages of the tinctures is that you can adjust the relative proportion of THC and CBD in products that look essentially the same. So you can actually have randomized controlled trials where you can have a placebo or a comparison between different strains to be able to get research done on what would be the ideal mix of CBD to THC for a variety of different indications. So I'm really hopeful that this is something that we will be able to get useful at some point in the future. So in summary, cannabis is a plant which really has a whole lot of potentially useful compounds. We're only really just beginning to see the start of it. We have a lot more research to do. I look at it in the same way that opium poppy was 30 years plus ago, when its therapeutic effect was only just beginning to be recognized in traditional medicine. I think we're going to see a whole lot of very useful products that come from the use of the cannabis plants in the next few years. Of course, there's a lot of song and dance about it at the moment, but I really don't see that this is going to be a panacea. There may be many treatments which have a small benefit, sometimes maybe a large benefit, but it's never going to be anything which everybody responds to, and I think that mild adverse effects are certainly common right now and are probably going to continue to be common with the products that we develop in the future. And though there is widespread recreational use, I think we're going to become more familiar with the actual toxic effects of widespread cannabis use, especially in recreational purposes, and especially in the young and mentally ill. So I think we're going to be able to refine our groups of people in whom we have to be particularly cautious further as we become more familiar with it and can do more research. I do feel that avoiding smoking it is going to be important. Though many people are smoking it and there hasn't been any clear association with smoking-related harm, there is good reason to think that because the products of combustion of tobacco and cannabis have a lot of similarities, it's quite likely that there will be a carcinogenic effect and it may cause COPD. The quantity smoked may be much less with marijuana than it is with tobacco, which may be why the risk appears to be much lower. It may be lower, but it won't be no risk. And also, in the past, it's been difficult to separate out the effect of smoking from medicinal cannabis use, smoking marijuana exclusively, because so many people used to smoke. That's something that we will be able to separate out, I think, in the future, because less and less people are smoking. So there'll be more people that smoke exclusively cannabis as compared to exclusively tobacco. So we may be able to compare the two a little bit easier. I think if you have a patient in whom you're thinking that medicinal cannabis may have a role, there's little harm in a carefully supervised trial as long as you look after, as long as you're careful of the cautions I've mentioned already and you warn about driving. I think as long as you start low with small dose and increase gradually until you have therapeutic effect with hopefully tolerable side effects, I think that you can really come to little harm. And I do believe that there is potential for benefit for a lot of patients who are currently not getting access to medicinal cannabis. So that's the end of my formal presentation, but there have been some questions that have been coming in, and I'm going to ask Michael if he can just list some of those for me so that we can go through them.
Absolutely, Dr. Hawley. We've had a question from one of our attendees who writes, in the initial presentation in part 1, the data suggested that the cannabinoids had more benefit when used generally as a whole rather than isolated compounds. Nabilone, Sativex, Marinol have all been available for some time and our synthetic isolates, where do we look for information on what form of cannabinoid or blend ratio is best suited for a particular condition, and where might you get this blend?
Well, that's a very good question, and one that I've actually been asking myself, and I've been doing quite a bit of work on in preparation for doing these webinars. Essentially, there's not a lot of information in the traditional medical literature, but there is information out there. Probably the best place to go to would be the Health Canada website, because they have a massive repository of research, clinical trials, and other reports on their website. And that would probably be the first place I would suggest going to. The other place would, though I very rarely recommend this, is actually to go to the Internet, because there are some excellent resources on the Internet which have been contributed to by patients, and you may be able to get some useful information there. What I'm hoping that, as I mentioned, with access to the tinctures or the drops, is that this will allow us to do future research where we can actually give people proper randomized controlled comparative studies in definable groups of patients, like patients with multiple sclerosis that have muscle spasm, patients with multiple sclerosis that have neuropathic pain, patients with cancer that have nausea, patients with cancer that have nerve pain, patients with cancer that have non-nerve pain, just regular pain. If we can isolate these groups of people so that potential users can put themselves into one of those categories of users, they can see what's been helpful to other people, and that will guide them as to where perhaps they should start for their own personal consumption, or the physician or nurse practitioner that's prescribing for them will be able to advise them on where they should go first. At the moment, we don't have that information, and this is something that really does need to be developed as we get more familiar with use of this class of drugs. Just going back to the prescribable products, Sativex is an extract from cannabis, and it does have the 50-50 mix, whereas the Nabalone is just pure THC, and Marinol, which is no longer available in Canada, was also a pure THC as well. So if you look at the clinical trials, when you look at studies of Marinol, which was previously known as the generic name Dronabinol, or Nabalone, which is trade name is Sesamet, remember that those are only THC alone. So studies of Sativex may show quite different results to studies of Marinol or Nabalone.
Interesting. And the same attendee asks, are these products really only for long-term or chronic conditions? I know that's been the focus of our webinar. Can you speak to the efficacy of medicinal cannabis for more acute conditions?
Yeah, I think that there may well be a role for medicinal cannabis in acute conditions like post-operative pain, etc. But at this point in time, we don't have any idea of what doses to use or how best to deliver it. These are things that hopefully we're going to have in the future. But the other issue is access. It takes a while to actually get hold of medicinal cannabis. We've talked about the procedure with going through the dispensaries, we've talked about going to friends, we've talked about going to the licensed producers. But most of those do take a minimum of a few days at least to get going. Even with the licensed producers having a really fast turnaround time, you've still got to get that initial medical authorization, and you have to have the shipping. So it's not something which is going to be able to be practically done really in less than a week. So that situation, I think, is what's going to limit us at the moment. If you've got someone who's been using it recreationally in the past or even medicinally in the past for a chronic condition, which has then got better and they've stopped using it, they may be able to kind of restart that process again and get started quite quickly. But for somebody who's never used it before to all of a sudden get access, I'd say even a week would be a pretty quick turnaround time, which limits the context that you can use it in.
Right.
Until we can prescribe it from a regular drugstore, like we could get Sativex quite quickly.
Right. And another viewer wonders where she might find information on where patients in specific areas, like on the island, might purchase or get access to medicinal marijuana. Is the Health Canada website
No, the Health Canada website will tell you where the licensed producers are, but they're not allowed to sell anything to you in person, so it won't help you. Like, it won't make any difference to you whether the licensed producer you choose is in Ontario or BC. It really doesn't make any difference to you because the shipping is, it can go all over the country. I don't even know if the cost varies depending on where you live. I suspect not. If you're shipping something, it doesn't really matter as long as it's within Canada. I think the shipping costs are pretty much the same. So if you want to go somewhere physically, you need to go to a dispensary, and there isn't a Health Canada link to dispensaries. They tend to pop up and then disappear again from time to time. You're probably best to use Google. That would be the most likely place to go. Just to do an internet search and just look for cannabis dispensaries or marijuana dispensaries, and then put in your geographical area like BC or Nanaimo or Victoria or whatever.
Great advice. And another attendee asks whether one needs to worry about the legality of bringing medicinal cannabis across the border.
Right, yes, and that's it's a no-go. You should not take any form of dried product across the border. If you have a prescribed product like Sativex or Nabilone, then that is allowed as long as it's in its original packaging and you have a note or a letter from your family doctor or or other physician saying that it is for medicinal purposes and that it's for you, so it's got your name and some other identifiers on it. Most people, when they travel, when they have opioids particularly, it's a useful thing to have some kind of letter, just so that you can hand it to the customs people and say, yes, I know I've got all these drugs, but this is what I have, and this is what they're for, and my doctor has authorized it. And the prescribed cannabinoids would be under that category, the same as a prescribed opioid like long-acting morphine or fentanyl patches. But I would strongly recommend you don't try to take any unlabeled, unprescribed product because they will impound it and you may well get put in prison.
Well, that's it for questions, Dr. Hawley. I want to thank you so much for taking the time this afternoon to share your expertise and knowledge on medicinal cannabis. And on behalf of the board of Pain BC, I thank you so much for your time.
Okay, no, thank you. Delighted to do it.